Hello, my name is Dr. Paul Asdourian, and I am a spine surgeon at MedStar Union Memorial Hospital. After decades of practice, I now have a whole new perspective on how my patients feel, the challenges and limitations they encounter, and the process they go through when they opt to have back surgery. This is because I went through it myself. I underwent the same surgery that I often perform because my own back pain had become unbearable. I would say that I first started experiencing back pain when I was in college. I was an athlete. I played football. I was a hammer thrower, which involves a lot of twisting and torquing of the back, and I would get back pain that would come and go. Over the last 5 years or so, the pain really would never go away, and it would hurt when I would move certain ways. I was a very physical guy. I like working outdoors. I started martial arts when I was 40 years old, and I worked real hard at it, but I found that any kind of twisting or torquing of my back would hurt me. And I can relate to patients who would tell me that when they're in bed and they try to roll in bed, they would have pain. I started experiencing the same thing. And it got to the point where if I had to walk half a block, I started thinking about it because I knew that I would start to have pain in my legs. It got to the point where my just everyday quality of life was really being affected. It was interesting that I was able to operate because when I operate, I stand in a little flexed position. So that was a position of comfort. So I was able to continue working, but when I got home, normal activities with my family were where I was really having my problems. Then it got to the point where even with surgery, I was starting to think about my back. So that's when I realized it's time to have something done. My surgery was in January of 2018, and the surgery went very well. When I went for my first appointment at 2 weeks after my operation, I had less pain than I did before the operation, taking no medication whatsoever. So when I started my physical therapy, it was about 2 months after the operation, and initially it was rough. My back muscles were sore, they were weak from not being used, and I had a good therapist who helped me increase my activities progressively, so that I was able to do more and more with each visit. You have ups and downs in the healing process. So some days you feel better than others, and that's just normal. But it was all worth it. I started to do the things I enjoy in my personal life. I started to feel like myself again. I had planned on taking about 6 weeks off from my practice. By 4 weeks, I was feeling great, and I was just itching to get back to work. So at 6 weeks, I was back to work and was really feeling great. How you doing?
I'm doing great, sir. Thank you. Just got to tell you, I was recently on a trip to Montreal. Walked 21 miles, no issues last year this time. Went on a trip to Amsterdam, couldn't walk half a block. And I feel great, wonderful. I'm back to exercising. I just feel great. Thank you. Really appreciate what you did for me.
Today I feel great, and I'm doing what I love best, which is helping patients with neck or back pain. I can definitely relate to my patients since I've really experienced their symptoms, and I've experienced their recovery, and I think this has made me a better physician. I only recommend surgery when I feel it's absolutely the correct thing to do for my patients. But now, having experienced it firsthand, I know how truly life-changing surgery can be.